Discuss about mandible. Simply, mandible means lower jaw. It is only the movable bone in the base of the skull. It is also the largest and strongest bone of the face, and it consists of horseshoe-shaped body, or this is horseshoe-shaped body or U-shaped body, which is convex and directed forward, and there is presence of two broad rami, which ascends posteriorly. Anatomical position of this bone on human body. Alveolar process is marked by sockets of tooth that lies above in the body of mandible, and this is convex and directed forward. Mandible lies slightly obliquely in the body. It is more or less horizontal. From the posterior end of the body there is presence of two rami which is projected upwards on each side. Now presenting part of this bone. It consists of body, this is body, and it behind that there is presence of two rami. Body consists of two surface and two border. That is, one is external surface or outer surface, internal surface or inner surface, and two border. Upper border or alveolar border, this is upper border or alveolar border, and lower border or base, this is lower border or base. It consists of two rami. Two rami also consist of two surface, that is lateral surface, this one is lateral surface, and this one is medial surface, and four border: anterior border, posterior border, superior border, and inferior border, and it consists of two process. This is condylar process and this is coronoid process. Don't confuse on here. The part which consists of condyle is known as condylar process. This is condylar process and this is coronoid process. Now I am going to describe each and every part of the bone. External surface, body. External surface of a body. It consists of symphysis menti. This is symphysis menti. It is a median ridge on the anterior surface. It indicates the fusion of two half of mandible. This is a median ridge in the anterior surface, and it indicates the two half of mandible. Mental protuberance. Mental protuberance means below the symphysis menti there is a triangular area. This we can see clearly here. There is a triangular area. It is known as mental protuberance. Mental tubercle. On each side of the mental protuberance there is presence of rise area. This is known as mental protuberance. Mental protuberance and mental tubercle forms a chin, and we can see a mental foramen. This, the large foramen here on each side, this is known as mental foramen. The structure pass through this foramen is mental neurovascular bundle, that is mental nerve and vessels. Both structure is emerged from this foramen. Okay, mental neurovascular bundle, mental nerve and vessels. External oblique line. This is a external oblique line, is a faint oblique line that ascends backward from each mental tubercle. This is and sweep below the mental foramen. From this here the line starts. This is external oblique line. Attachment of external oblique line are depressor labii inferioris and depressor anguli oris. Below the external line it gives insertion to the platysma. Below the external line it gives insertion to the platysma. Posterior end of external oblique line gives to the muscle origin of a muscle to the buccinator. Posterior end of line gives to the origin to the buccinator muscles. Now incisive fossa. Incisive fossa is a shallow depression below the incisor teeth. It gives origin to the mentalis and part of orbicularis oris. Internal surface. Now I am going to discuss about internal surface. Internal surface, there is presence of a mylohyoid line. Mylohyoid line, it extend diagonally upwards and backwards. This we can see clearly. This is a mylohyoid line, upwards and backwards from the lower part of symphysis menti to the inner surface up to the alveolar border of little below the third molar teeth. This is mylohyoid line. This line divides the internal surface into upper sublingual fossa and lower submandibular fossa. This mylohyoid line divides this internal surface into upper sublingual fossa and lower submandibular fossa. Attachment of the mylohyoid line. Attachment of mylohyoid line gives attachment to the mylohyoid muscles. Mylohyoid line on the posterior end gives attachment to the superior pharyngeal constrictor. some retromolar fascia of vocinator and pterygomandibular raphe, mylohyoid group. There is a group on the lower posterior portion of a mylohyoid line is known as mylohyoid group. This is known as mylohyoid group. Content of mylohyoid group is mylohyoid neurovascular bundle. Sublingual fossa. Sublingual fossa, already I mentioned that above this mylohyoid line there is presence of the line above the mylohyoid group is known as sublingual fossa, on which there is relation to the sublingual gland, and below the mylohyoid line on the posterior 2/3 of the mylohyoid line is here this area there is a content of some mandibular gland. Here there is a content is relation with submandibular gland. Usually the loop of facial artery lodge in this submandibular fossa between the bone and gland, where we can from outside also we can palpate from this area we can palpate the facial artery. Mental spine or genuine tubercle. Generally there is presence of upper and lower mental spine. Here we can the upper and lower mental spine, and in some time but they may fuse from the single eminence in that may part that is indicated by irregularity of the surface. Generally there is presence of upper and lower mental spine, but in here in this bone also there is a union, and this mental spine is indicated by this irregularity. Okay, and attachment of mental spine. Upper mental spine originate from upper mental spine there is origin of genoglossus muscles, and from lower mental spine there is origin of genohyoid muscles. Lingual foramen. Lingual foramen is generally present above the mental spine. Here we can see small foramen, and lingual foramen it consists of the branch of lingual artery. Okay, it's useful in a radiological landmark. Now border of the body. Upper border or alveolar border, it consists of 16 alveoli of the for the roots of the lower teeth, lower border, lower jaw teeth. Okay, they are alveolar process, and the sockets of incisor, canine, premolar teeth consist of single root, whereas behind 3 molars consist of 2 or 3 root. Where we can see clearly there is a single alveolar process in front, but for behind for 3 molar there is presence of 2 or 3 alveolar process. Attachment of superior border. Periodontal membrane is attached in the cavity. Periodontal membrane is attached in this cavity and pterygomandibular raphe. Okay, periodontal membrane is attached. Periodontal membrane and pterygomandibular raphe is attached in upper border. Lower border or base of mandible. Okay, this is lower border or base of mandible. There is presence of digastric fossa in lower border. There is presence of digastric fossa. Digastric fossa gives origin to the anterior belly of digastric muscles. Digastric fossa gives origin to the anterior body of digastric muscles. Insertion of platysma take place, gives attachment to the investing layer of deep cervical fossa through the border. Throughout the border there is a presence of the investing layer of deep cervical fossa. Ramus of mandible, there is presence of 2 ramus. Each ramus is obliquely longer than wider, that is around more or less rectangular, flattened plate that extend vertically upward. Surface, it consists of 2 surface, lateral surface and medial surface. Lateral surface give attachment to the masseter muscles. Here this is a masseter muscles, give attachment to here in demarcation by red mark masseter muscles. In front of the masseter muscles there is presence of facial vessels is present, and in the anterior border of masseter muscle. Okay, now we are going to discuss about the medial surface of the ramus. Medial surface consists of the mandibular foramen. This large foramen you can see here, this is mandibular foramen, and this foramen is related to inferior alveolar vessels and nerve. From this foramen there is a relation of inferior alveolar vessels and nerve. Anterior margin of mandibular foramen. Anterior margin of mandibular foramen is upwarded by a tongue-like depression known as lingula. Okay, in a lingula mandibular end of sternomandibular ligament is attached. Here in lingula in lingula, mandibular end of sternomandibular ligament is attached. Behind lingula, there is presence of mylohyoid groove which extends downward, forward. In this, I already mentioned the attachment of mylohyoid groove. There is presence of nerve to the mylohyoid muscles, and medial pterygoid muscles is attached in posterior inferior. Medial pterygoid muscles is attached in posterior inferior to the mylohyoid groove. Posterior inferior in the mylohyoid groove in this rough surface. Okay, and border there is presence of foreborder, superior border. This superior border is short, in which there in front there is presence of triangular flat part of a bone known as coronoid process, and behind there is presence of condylar process. Inferior border, it is continuous with the base of mandible which meets the border at angle. Superior border, and this is inferior border. In the adult male, the angle of mandible is about 110 to 115 in adult male. Attachment to the inferior border. At the angle of the mandible, there is stylomandibular ligament is attached. This is angle of the mandible where there is attachment to the stylomandibular ligament. Attachment to the muscles in a coronoid process is temporalis. There is in the coronoid process there is the attachment to the temporalis, and attachment to the condylar process there is a lateral pterygoid. In here there is presence of lateral pterygoid muscles. Posterior border, this is posterior border, there is not a defined attachment in the posterior border, while in anterior border, this is anterior border which starts from the upper end of the upper end of this process, and it extends up to the external oblique line and give insertion to the lower fiber of temporalis muscle. Now I am going to discuss about the process of this bone. There are two processes. This is coronoid process and this is condylar process. Coronoid process have two parts, that is temporal crest and retromandibular fossa. This is temporal crest. Behind this crest there is presence of a small fossa. This is retromolar fossa. Coronoid process gives insertion to the temporalis muscle. I already mentioned that here is the origin where gives it insertion to the temporalis muscles. And condylar process, this is condylar process, and it has two parts, one is head and one is neck. Attachment in the neck, in the neck there is attachment of lateral pterygoid muscle. Okay, here is the attachment of lateral pterygoid muscles, lateral ligament of temporomandibular joint. Here also attachment of lateral pterygoid muscles and lateral ligament of temporomandibular joint. Relation to the neck of condyle. In this neck there is a presence of some relation. This relation is parotid salivary gland, auriculotemporal nerve and maxillary artery. Now the ossification of this bone. It is the second bone to start ossification after clavicle. Okay, each half of a bone is ossified in the 6th month. Here from here we can divide the half. I already mentioned that each half is divided from the 6th week of intrauterine life, mostly from the membrane from the fibrous envelope of Meckel's cartilage from the first brachial arch. The ramus above the mandibular foramen. The ramus above the mandibular foramen is ossified from the secondary cartilaginous joint, which is also attached to the Meckel's cartilage, and extension from the same ossification center. Two half of the mandibular body are unite to form a fibrous joint from in a symphysis cementi, which is replaced by a bone within a 2nd year of life. Now I am going to discuss about the change of mandible with life. Okay, during a birth time there is presence of mental foramen just in above of the base of mandible. In the teeth, that is temporary teeth, starts to grow at the 6th postnatal month, and that is completed within 2 years. In adult, the mental foramen lies around the midway. We can see here in this mental foramen lies in the midway, but in the old age, due to the loss of teeth and absorption of alveolar margin, due to absorption of alveolar margin, mental foramen comes slightly above here. Due to absorption of this, then we can see that we will be assume that this will be grow up, but this is due to because of this absorption of this alveolar process.
1, 2, 3 go.
Now I am going to discuss about the summary. In summary, only I will discuss about the some important muscles, that is muscles of mastications is related to this bone, and muscles temporalis. Here in this area there is temporalis, buccinator, in this area there is a buccinator, masseters, in this area there is a presence of the masseters, lateral pterygoid, here there is a lateral pterygoid, and inside the bone here in this area there is presence of medial pterygoid muscles. There are 7 arteries related to this bone. Maxillary artery in the neck of mandible, inferior alveolar artery in the mandibular foramen, mylohyoid artery in a mylohyoid group, mesenteric artery in the mandibular notch, facial artery, mental artery in the mental foramen, superficial temporal artery in the medial side of neck of mandible. There are also 7 nerves related to this bone. Okay, lingual nerve, auriculotemporal nerve, mesenteric nerve, inferior alveolar nerve, nerve to mylohyoid, mental nerve, marginal mandibular branch of facial nerve. Their relation is already described. Major salivary gland, that is presence of major and minor salivary gland. That major salivary gland are related to this bone. Parotid gland, submandibular gland in submandibular fossa, sublingual gland in sublingual fossa. Clinical anatomy related to this bone, that is mandibular fracture is commonly by the direct violence, because it is a U-shaped bone, and it is there is a presence of double fracture slightly in the opposite side. For example, a fracture is present in the neck of the mandible of one side. It may associated with the fracture of bony on the region of neck sides. Another interesting things related to this bone is fossy jaw or glass jaw, which is present in the chronic phosphorus poisoning. At first there is toothache, which is followed by the swelling of the jaw, losing of the teeth, necrosis of the gum, subsequent change in the bone of the mandible. This condition is known as fossy jaw, on which there is the osteomyelitis and necrosis of the lower jaw occurs, with multiple sinus discharge and foul smelling of a pulse.